Today's video is about nervous control of the blood pressure. The blood pressure is controlled by various mechanisms in the body. As baroreceptors control the body pressure while changing in position. If you are sitting and stand up, the blood pressure will change due to gravitational effect, and that blood pressure fluctuation is controlled by the baroreceptors. They are responsible to keep the blood pressure at a certain level. Renin-angiotensin system is responsible for the long-term control of the blood pressure. But when body needs rapid increase in blood pressure, here the nervous system comes in action, and that's what the sympathetic nervous system is made for. Body operates with two contemporaneous autonomic nervous systems, sympathetic and parasympathetic. However we read and describe them separately, they operate at the same time. Both of them are in action all the time to give a body a homeostatic state to operate. We will be mostly talking about the sympathetic nervous system here because the rapid control of the arterial pressure is mostly controlled by the sympathetic nervous system. However, the firing of parasympathetic nervous system to the heart is also decreased at the same time. If you saw a lion all of a sudden, your heart will start beating so fast and your BP will shoot. That is the mechanism to prepare the body for the run of the fight. That's why the sympathetic nervous system is called fight or flight nervous system. And in this case, you can't fight, obviously, you have to run. For running, your skeletal muscles will work more and they will need more oxygen. And your heart will have to pump more blood to your muscles to meet the demands of your skeletal muscles, and you have to breathe fast to take more oxygen so your blood gets more oxygen because your body will work more. It needs more oxygen and fast, and it is done by the rapid increasing of the blood pressure by sympathetic nervous system. The spinal nerve from the T1 to L3 carry the sympathetic nerve fibers that innervate the vessels of the body. You can see here the spinal nerves originating from the T1 vertebra, thoracic 1 vertebra, to L3 vertebra, that is lumbar 3 vertebra. The spinal nerves originating here carry the sympathetic fibers to the blood vessels and all the organs that respond when the sympathetic nervous system is activated. All the organs as well as blood vessels have the receptors for these nerves. These receptors are alpha and beta receptors. The alpha receptors constrict the blood vessels in the response of stimulation of sympathetic nervous system, and beta receptors dilate the blood vessels in the response of sympathetic nervous system. The heart vessels have beta receptors, so the heart vessels dilate instead of vasoconstriction, because if the heart vessels will constrict, it will make heart short of the blood, and in this whole scenario the organ working the most is the heart, so it needs more blood to work. So the sympathetic activation, where it increases heart rate and the force of the contraction of heart, it causes dilation of the blood vessels instead of constricting it. Lungs also have beta receptors because the lungs vessels have to dilate to get more oxygen, and constriction of lung vessels will worsen the situation as body is needing more oxygen. All the systemic vessels have alpha receptors because they have to constrict to raise the blood pressure. Okay, now you understood the basic mechanism of sympathetic nervous system, how the sympathetic stimulation is affecting on body vessels, how it is affecting on heart vessels, and how it is affecting on the lung vessels. Now see what happens when sympathetic nervous system is stimulated. Now we will just be discussing the systemic arteries and arterioles. So as the spinal cord signal activate the ganglia, your sympathetic ganglia then send the necessary signal to systemic arteries, and this causes constriction of all systemic arteries. As if head of the hoe is pressed, water will come out with much more force. So this constriction of arteries because of the stimulation of sympathetic nervous system increase peripheral resistance of the arteries and increased blood pressure. Veins are also constricted by the sympathetic nervous system as the veins retain as much as 70% of the volume of the blood. Constriction of the veins cause the volume shift toward the heart. So heart start beating fast and produce more conduction forces to pump the blood out. The heart itself is also stimulated by the sympathetic nervous system, and concomitantly its parasympathetic supply is also decreased. This further enhances in the heart pumping. The heart rate is enhanced sometimes as great as 3 times normal and pumping 2 times normal volumes. The specialty of nervous control of the arterial pressure is its rapidity. This is far most rapid of all mechanisms for pressure control.